No matter what they call it, no matter what they want it, they don't know there's no way they'll ever get it.
All right, man. So if you can bring up, we're going to start off with a video. This comes from the WHO coronavirus press conference on March 30th, so a little over a week ago. It's going to feature Dr. Ryan, who's sort of leading the WHO's pandemic response emergency team. The reason why I'm starting with this and going into this is because this deals specifically with sort of freedoms and a slow move towards that totalitarianism approach to things. I'm going to start with the video, then we're going to go down a couple streams with that. I got some graphics and quotes and just kind of explore this rabbit hole a little bit before we get to the main topic. So I'm going to go ahead and start it now for you.
Most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's what I was saying previously about the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts, and follow up on the contact health at all times, and then isolate any of those people who become sick themselves.
All right, so that was Dr. Ryan, who's the emergency management guy from the WHO, basically saying, you've heard the statement, flatten the curve, flatten the curve. Well, we've taken all these steps with lockdown, social distancing, and we should start to see that curve flatten soon. But what the WHO is saying is that that's pushed all the spread from out on the street and the workplaces into the house. And so basically now they are encouraging countries and states to go door to door and start seeking out and identifying sick individuals and removing them from homes in order to further stop this spread. So instead of flatten the curve, we're going to start hearing push down the virus, because once we flatten that curve, we're going to stay there. The virus isn't, the deaths and the spread's not going to go down automatically. It'll just level off, but we'll continue to have it. You've got to push that curve down, and he's right with that. You have to push it down. But completely scary to basically be saying, hey, what countries need to be doing is knocking on doors, identifying sick people, and removing them from that home to a safe government facility, treatment center, where they'll, of course, take care of them. Now, this makes a lot more sense in most of the rest of the world. You know, it's not initially going to necessarily go over well in America, but you got to remember that the WHO, the UN, they hate individual rights. They're big status people. That's why they're in the pocket of China. They don't like individual rights. They don't like family rights. They don't like parental rights. So this is right up their alley. The scary thing is that though that's not a normal message for America, and right now the Trump administration doesn't have a real good opinion of the WHO, a lot of medical experts and people still listen to the WHO, and it at the very least influences some of their decisions. So you're going to start hearing this message. We've got to restart the economy. We've got to get people back to work. Well, you got to have a safe environment to do that. And one of the ways that you're going to do that is by going around and removing people that are sick so that other people can get back to work. Really scary. People are going to start knocking on the doors. Now, the problem is you obviously can't check all homes. So how are you going to do it? Well, you're probably going to have some kind of surveillance system. Sort of something like White House senior advisor Jared Kushner here, who's seeking a national coronavirus surveillance system. He wants to create a national coronavirus surveillance system to give the government a near real-time view of where patients are seeking treatment and for what. This would represent a significant expansion of government use of individual patient data, forcing a new reckoning over privacy limits amid the national crisis. Currently, and I'm reading from the article here, currently the federal government plays only a limited role in handling health information. A lot of the database flows through the CDC through voluntary action with states and hospital systems. The federal government's been restricted in access by various privacy laws, but just like 9/11 with the Patriot Act, never let a good crisis go to waste. They're going to start wanting more and more control of data and looking into things. And basically, this would draw on detailed information collected from multiple private sector databases. Some other health experts are saying, hey, instead, maybe we should build out and reorient an existing surveillance system, like I was speaking about, housed with the CDC. And what they have is the National Syndromatic Surveillance Program, which is a voluntary collaboration between the CDC and various state and local health departments that draws data from more than 4,000 healthcare facilities. Basically, this is just some information from the CDC on the existing system that we have, understanding that the federal system would be this on steroids and would, of course, call on Google and everybody else to help data mine information. And this might be one way that they could identify, okay, somebody from this family was at this hospital with these symptoms. Let's go knock on the door and see how they're doing. And basically, the CDC version collects, analyzes, and shares electronic patient encounter data received from the emergency departments, urgent and ambulatory care centers, inpatient healthcare settings, and laboratories. And then all that data is integrated through a shared platform in the cloud called the BioSense platform, in which different parties can use analytic tools on that platform to analyze that data as early as 24 hours after a patient's visit. So this moving this way, it makes it a very real possibility that health authorities, along with law enforcement, in order to provide a work and ensure we have a work environment that's safe for people to go back to work, this could play into it. Like, it's easy to say, oh, that just happens in totalitarian areas of the world. It could very easily happen here.
While you're showing that graphic, we have a couple chats popping up here in reference to this. Harbinger says to the first video, they want to come knocking on houses now. If that's the case, then that's a very good way to get a high dose of lead. And I couldn't agree more. Let people come knock on my door, trying to get a census of sick people, or even if they have some type of warrant, because they have this hospital data now that the CDC and the WHO is trying to get everybody to have access to in America. You know, if the sheriff comes to my house and they say, hey, look, we know we know your wife went to the hospital and she had COVID-19 symptoms, and even though the test result won't be back for 2 days, we're going to take her into a mandatory quarantine. Yep. They're not taking her. I mean, it's that simple.
Your daughter gets sick. Your son gets sick. Your mom or dad gets sick. All of a sudden, you're going to get that knock at the door. And, my point is that, again, we need to be prepared. We need to be thinking 3 steps ahead so that we can prepare for that and determine what our response is going to be.
So another thing is Simply John chimed in. He said he likes the idea of finding the people, but with the minimum of giving them the option. Like, you can't just take people against their will, but I do believe those who are infected might decide to go, which it is. There is some truth to that. Some people, if it's for the better good, people are a pretty understanding animal. We're pretty understanding as creatures. We get, how there's solutions to problems. And as long as it's a voluntary action and it can help reduce the spread, there is some truth to that. If they say, hey, look, we know you had these symptoms, we can offer you a quarantine place, that's a lot different. They're not even considering that route, though. They're going straight to mandatory taking, mandatory quarantining, mandatory shipping to those FEMA camps.
Those treatment facilities.
You don't want to say that too loud.
Containment dumps.
Yeah, the containment facilities, that's some scary shit. And then, we just ended off with, of course, welcome to the beginning of 1984. And that's very true. It's very scary how quickly we went to that. Honestly, America's been kind of 1984 since 9/11 in the first place, with the NSA and Homeland Security literally listening to every phone call, every Google call, everything through any type of data transfer. It's being tracked and logged somewhere. Homeland Security officials have come out and said that they have almost every single phone call made in the United States and outlying areas since 2003 recorded, and there at some point in time is being put through some machine learning AI, and the calls are being scanned, and they have all this crazy amounts of personal data, from photos to text messages to emails, that they just have. It's trillions and trillions and trillions of data that they have stored, that they've collected over the past 20 years, and they don't know what the hell they're going to do with it, but they said it's helped stop some crimes. Of course, they say it has.
Of course.
I think they're just selling it to advertisers and advertising companies, because then they would have their hand in both sides of that money, because there's a lot of money and information. But yeah, so that's kind of where we're at with the COVID-19 updates for today.
Yeah, well, I'm gonna go a little bit further on this before we switch topics. I've got a few things I want to add to that, but just to kind of show the possibilities here, because a lot of people say, "Oh, that'll never happen." Well, here's some photographs from Rhode Island, who's doing border checks trying to prevent New Yorkers, and now anybody from any state outside of Rhode Island trying to get in. And they have also gone door to door. They've identified neighborhoods where a lot of New Yorkers had vacation homes and things. They're knocking on the door of the law enforcement, asking for proof of residence there, how many people are supposed to be in the house, enforcing this 14-day quarantine. So you can see on the sign there, it says all non-Rhode Island passenger vehicles must stop at the rest area. You stop at the rest area and you're confronted by military police from their National Guard units. And these are pictures from the news at these checkpoints. A governor ordered state police and National Guard to hunt for New Yorkers because of coronavirus fears. It's a frightening sign of what's to come during the pandemic. But this is crazy, dude. This is the U.S. This is the border of Rhode Island with military police and Humvees stopping people.
Do you remember 5 weeks ago we were talking, and I was talking to somebody on the phone, and I think you were already here. You're at my house on the weekend. I might have been talking to my brother, or I think I was talking to one of my friends. I think it was just one of my friends who happened to call me, and he asked me, what do I think is going to happen? And I said, it's not going to be long until you see the National Guard units called up. It's not going to be long until you see the military enforcement of strict borders, of these mandatory quarantine checks and mandatory testings and symptoms checking, and they're probably doing some type of on-the-spot background check at these rest areas. I told him all this stuff was coming, and he told me, I'm in the military. This isn't going to happen. If you see these Humvees moving, they're just transporting them. If you see tanks moving, they're just transporting them. And he honestly, he told me a couple days ago that shit's getting real. They're being called to local stations. They're having people come back from overseas to help fulfill these orders that their units are getting. And that's the crazy part, is that this is now a domestic threat, and the National Guard needs help from other smaller units. The National Guard units that were deployed overseas, that were kind of the tandem units with our Army and militaries, they are being sent back home, back to their main state that they were stationed on in the first place, and they're being sent to these border checks. So he told me straight up, holy shit,
it's getting real.
I didn't think it was going to happen. He said, ask somebody who is in the National Guard. He was overseas at the time. He didn't think it was going to happen. And now he's back here. He's back at his home state of Virginia, and he is sitting here getting ready, getting orders to go do border patrol. In Virginia. It's crazy.
Crazy. Here's another one of them. And then, of course, we talked the other night about Texas. Here's the roadblock between Louisiana and Texas with state troopers.
But yeah, that's the crazy, scary part. So I'll read up the check while you get that photo set up. Harbinger says, look at that. Everybody wants strong borders. It's almost like if we would have had strong borders from the get-go, The last 20 years, at least in America,
National
might have
border,
been
I'm
better.
good with.
Right, no, that's what we're saying. Is all these people that that are
Now,
against the wall, that are against strict
exactly.
borders, that we need diversity. Now it's we don't want other people in our states. We don't even want other states in our states. Okay, it's just a little jab at the anti-border people.
No, absolutely. You can pull it back up now. So another way, besides this surveillance, that I think they're going to start identifying things and getting this safe environment. Dr. Fauci just came out and said that he wants to do coronavirus immunity tests and that they're coming soon. This is a little different from testing whether you have the virus itself, whether you're sick. This checks your blood serum to see if you have those antibodies that we've talked a lot about. So he says here, it'll show if a person has previously been infected with the coronavirus and therefore gained some level of immunity. The New York Times correctly points out here that it remains unclear exactly what kind of immunity a person may have once they even recover from this. Because we talked about the South China information coming out. That was 51 people on Monday that they had identified as basically the virus having reactivated in them. They're sick again. They don't think they were re-exposed. They think it went into remission and then they got re-exposed. It's up to 91 cases now on Friday. So it's nearly doubled in 5 days there. When you combine that with the reinfection and the fact that the second time you get this, it can be much worse, and the fact that's a scary thing because, like we've talked a lot about, where we could be walking coronavirus time bombs, especially younger people, because when they're testing for these antibodies, the younger people 40, 45-ish down who have the mildest cases are not developing a high level of antibodies. So Dr. Fauci says we still rely appropriately on heavily on tests to show that someone is in fact infected, whereas the antibody test says that you were infected, and if you're feeling well, you're very likely recovered. Well, that's crap. But he also stated that they might consider issuing immunity certificates, which could be carried by Americans who test positive for these antibodies. So this is going to be another thing. So you're going to get a certificate when you're clear to go back to work. And we're also going to have data of people that are sick, and we're going to isolate those people. So you see a plan here developing to push the virus down and restart the economy. And to me, it's scary because it's almost like a scarlet letter. If you don't go get your blood work done and you don't have this certificate, it's like you got a big C on your chest.
If you don't give up your information,
Yes.
your blood information, your health information to the government, you're not going to be allowed into society. It's almost like getting a barcode back in the 40s, right?
It's yes, absolutely. But one more thing before we move on, I want to talk a little about Dr. Fauci here because he's really pushing this serum testing for antibodies, and he's really pushing for this vaccine development and everything. If you want to pull the stream off real quick, I'm going to reset it for the next one.
So yeah, I mean that to me is honestly not the best idea. I think that that's going to cause a lot more civil unrest than it is good, and without even an inkling of a promise of a vaccine out there, what is he expecting this to accomplish? I mean, what would be the point in doing antibody tests without even having a way to cure the vaccine? I mean, you look at the doctors that are treating this shit, and they say all they can do is they can mitigate your symptoms, but if your body can't fight the infection, they have no way of fighting this yet. The antibiotics don't work. Antivirus drugs don't work. They have no way of actually fighting the disease. They can assist you with your breathing, make sure that you're comfortable, and that's it. It's almost like the reason why this is so hard on healthcare workers is, and I've been following a lot of doctors on social media lately. I've been finding a lot of them that do like Instagram live videos and informative updates, and some of them take the approach that like, it's no different than if you get the flu, we can't really treat the flu. There's no cure for H1N1, but there are ways. They understand that virus a lot better. They understand the symptoms. They understand when you need to get your anti-fever medication, when you need to get your steroid injections, when you need to get this. They have a much more wide understanding of that virus and how it affects your body. With this, I mean, I see doctors breaking down on their Instagram lives because they're getting asked questions that they can't answer, and they watched 25 people die all the exact same way today, and it's like they can help you with the symptoms, right? They can help you breathe if you can't breathe sometimes. They can help you with the side effects, but they can't help you with actually fighting the virus. And if your body isn't strong enough, if you're not strong enough, if you don't have a strong enough immune system, or if you maybe had a underlying health condition that you didn't even know existed, like anemia and stuff like that, just weird things that go undiagnosed all the time, you're pretty much a candidate for death, and they just have to sit there and watch you die. And that's why this is so hard and so much different than the flu, and that's why it's so important to help stop the spread of this virus. So doing something like what Dr. Fauci is saying, getting these antibody tests right now, especially soon, that's just silly. Like, why don't you dedicate resources to actually fighting the virus and actually curing the virus instead of developing ways to track the virus? Like, I get that in his mindset, he thinks he's helping stop the spread of the virus, but he's not. He's really just collecting data for the government to use.
Well, and you got to remember, he's now a spokesman for the administration. He's gone from being a pure scientist and expert epidemiologist to now he's a political face. He's having to make political cases.
But now he's also a celebrity.
Yes, and he loves it. You can watch. He loves the attention. He's learned the power of sound bites. He's all over the place, all over the board. From it's horrible, it's nothing. We're gonna have 300,000 now. It's 60,000. He's all over but he's learned the power of that 30-second soundbite that gets him attention, and he's also selling a political message now because he's a Ponzi for the administration, right or wrong. I do. The second part of Fauci is that we talked on Sunday conspiracies about Soros, that billionaire, and some of the rabbit holes you can go down with the lab in Wuhan with him. Another person that comes up an awful lot is Bill Gates and the Bill and Melinda Gates Foundation. And I just wanted to kind of show the connection between Bill Gates, the WHO and the UN, and Dr. Fauci. There are very, very strong connections there. And Bill Gates has made a huge, huge bet on the development and control of vaccines. So I think there's, when you got to be careful about Fauci's advice, because I think there's a lot of power and a lot of money in the vaccine game. And Bill Gates has tried to take out the market on that. So here's a press release going back to 2009, 2010, where the Bill and Melinda Gates Foundation basically announced that they were going to launch this decade of vaccines collaboration. And it's aimed at discovery, development, and delivery of vaccines. Now, they always try to sell this as it's for the poor and the third world countries. Don't buy into that. They're doing this for a reason. But if we go on, the collaboration follows the January 2010 call by Bill and Melinda Gates for the next 10 years to be the decade of vaccines. They're going to seek to identify critical policy, resources, and other gaps that need to be addressed. And it's going to be guided by a leadership council for oversight and planning, and this is a multinational deal. So, who's on the leadership council starting back in 2010? Oh, Dr. Anthony Fauci. He's on the leadership council along with the WHO, somebody from UNICEF, somebody from the Bill and Melinda Gates Foundation. They're very close ties going way back with Dr. Fauci to this movement. Here's some pictures of him. Here's Dr. Fauci down there. I'm sure everybody knows his face, but you've got UNICEF, WHO, the foundation, you've got African Leaders Malaria Alliance, very left-leaning, very global-oriented deal. And I wanted to look at the Gavi Alliance because that was the other piece of this with this CEO from there. Basically, the Gavi Foundation, again, was founded by Bill and Melinda Gates, their foundation. It's just like Soros. It's one giving to another, and all this. It's an independent public-private partnership and multilateral funding mechanism. And one of their goals, which I found really, really interesting, was number 4, shape markets for vaccines and other immunization products. If you control the vaccine, you control everything when you have a pandemic like this. You can pick winners and losers. You can give it to who you want to for favors. You can set the pricing on this. There's a lot going on there. United States federal government is a huge contributor to this. His foundation is a huge contributor. So his foundation alone's given $3.8 billion to it. Our federal government's given him almost $2.2 billion. And you can see starting in 2000, there was this huge spike in funds just going into this one little part of this coalition here. So it's almost like the vaccine cartel led by Bill Gates. So, again, my point on it, sorry, I was closing some things out. My point is not to bash on Bill Gates. He may, at some level, be trying to do good things, but I think there's some other motivations there. And even though you maybe think you're doing something for the greater good, it's a lot like the global folks, the UN, the WHO. They feel knocking on doors and forcibly dragging people out like China did, which they applauded and clapped as people were drug yelling and screaming with machine guns at their head out of their homes because they were sick. You may think that's the greater good. I disagree with that. And we got to be careful with Dr. Fauci. I used to have a lot of respect for him because he was a fairly good scientist and whatnot, but some troubling connections with some things with vaccines and whatnot, and I'm really starting to see him push things in a certain way that's troubling, and this all kind of wraps together like a big ball of yarn.
So the two things that I know personally to be true is that there's two ways effectively to corrupt anybody regardless of the moral compass, and that's with the promise of money and the promise of power, and usually they go hand in hand. And in an environment, especially with vaccines and the medical world and the way it is, money and power are there in a surplus. If you can create a vaccine, you can literally control the population of the United States. You can control the elected officials. You can control the political side of things. You can do these weird back alley deals, getting different agendas passed and different people into different positions of power as you see fit.
But I think what it does speak to is that these society-wide measures are difficult. They are not easy, and they are hurting people. But the alternative is even worse. And countries, if they're going to be able to move away from this approach of having to lock down and shut down, if we're going to move away from that approach as a means of suppressing the virus, we have got to put in place the public health surveillance, the isolation, the quarantine, the case finding, the detection. We have got to be able to show that we can go after the virus, because lockdowns alone will not work. But unfortunately, rather than basing this on modeling, let's base it on experience, right? We saw what happened in Wuhan after the lockdown, and not only did they do that physical distancing and put people in their homes, but they continued to look for cases. That's the essential difference. They continued to detect cases and isolate all cases, including mild cases, away from their families. But the way you stabilize and then move to zero, and I think everyone's talked about the curve up, and everyone talks about the stabilization. The question is, how do you go down? And going down isn't just about a lockdown and let go. To get down from the numbers, not just stabilize, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on. What is the strategy now to put in place the public health measures that will push down the virus after those measures may be released properly, we tend to use the word isolation for someone who is a case confirmed. We tend to use the word quarantine for someone who's at risk of being a case, usually a contact. So on that basis, we advise that all suspect cases are tested and all suspect cases are isolated in an appropriate medical facility. I think nobody disagrees with that, where the capacity exists. When we come to contacts, it very much depends on the context and the intensity of the epidemic at any given moment. In low incidence areas where there are sporadic cases or clusters, we advise that all contacts should be quarantined. Ideally, that quarantine should occur in a place other than the home. Home quarantine of contacts is acceptable with appropriate information, education, and more importantly, a very rapid system of getting those people out of their homes if they become sick. The clarity of that in Singapore, that ability not only to isolate cases, but to rapidly detect illness in the contacts and remove those contacts should they become sick, was a central part of that. And as he said, that wasn't, they're using apps now to do that. They're testing apps, but they didn't do it with apps in Singapore. They did that with community workers, with public health workers, visiting the houses, checking on people, checking their health status every day and saying, how are you? Have you got a fever? Have you got a cough? And if a contact has developed a cough or a fever, they were taken immediately for testing. Case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's what I was saying previously about the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate confirmed cases, track contacts, and follow up on the contact health at all times, and then isolate any of those people who become sick themselves.